Hello, so this is the Super Peace People getting together for our hackathon here. We have Darcy, my name's Christy, and this is Sky. So we're going to be talking about vaping. For my job, I'm actually a hospice nurse and I drive around all day long, and it's so often that I look next to me and I see some big puff cloud of vape. It seems so prevalent lately. With that being said, though, it seems like lately in the news we've been having things come out with a lot of respiratory injuries, illnesses, different deaths and stuff. So, what are some of those statistics? I found the American Nurses Association, there was an article just back on November 14th saying that there were this week 2,172 lung injuries. And last week there was 2,051. So that's 121 more cases in just a week. So we know as of right now, they're coming out with all of these problems, and there was actually even 42 deaths that we're up to. And so we're starting to see this problem. There was, back in 2015, Sergeant General said that there was determined to be a 900% increase of high school students using tobacco products, and 40% of them had never smoked regular tobacco. That's just shocking to me that there's these youth out there that may have never tried any regular tobacco products that are starting to use these e-cigarette products. And we're seeing how detrimental they can be, even causing death in people as young as 17 years old. There's another crazy statistic. It says, I'm just going to quote it here. It says, this is from the CDC website. It says, youth use of tobacco products in any form is unsafe, whether it be smoked, smokeless, or electronic. If cigarette smoking continues at the current rate among youth in this country, 5.6 million of today's Americans younger than 18 will die early from a smoking-related illness. That's about 1 of every 13 Americans aged 17 years or younger alive today. So it's like, this is a huge problem. Where are we headed? What are we going to be doing with this? What are the actual risks, and where do we go from here?
So kind of following that, going into what's actually in e-cigarettes and kind of the health risks there. E-cigarettes produce a number of dangerous chemicals, including acetaldehyde, acrolein, and formaldehyde. All of these different aldehydes can cause lung disease as well as cardiovascular heart problems and heart disease. E-cigarettes also contain acrolein, which is an herbicide primarily used in weed killers. It can cause acute lung injury, COPD, asthma, and then lung cancer as well. So even though not all e-cigarettes contain or require nicotine for use, there are so many other harmful chemicals and carcinogens within the substances that are being used that they pose major dangers for the users themselves and for their health. So another statistic, well, it's not really a statistic, but the U.S. Surgeon General and the National Academies of Science and Engineering and Medicine have all warned about the risks of inhaling secondhand e-cigarette emissions. And those are all created when e-cigarette user exhales all of that chemical and puff of smoke when they're using that cigarette. In 2016, the Surgeon General concluded that secondhand emission contains nicotine, ultrafine particles, flavorings, and chemicals linked to serious lung diseases. There also is found volatile organic compounds found in car exhaust and heavy metals. So the Food and Drug Administration has not found e-cigarettes to be safe under any circumstances, and it is not found to be safe and effective in helping smokers actually quit smoking. Brain development is not complete until age 25, and all of these different chemicals that are found within these e-cigarettes actually can affect the brain development. So more risk factors. Kind of going into youth risk factors though, there are a lot of different social and physical environmental factors, such as that young people are more likely to use if parents smoke, The media itself depicts tobacco use as normal, and that it potentially poses positive outcomes such as like weight loss and stress decrease, which is pretty popular in school-age children. Youth are also more likely to use if others their age are using, or if they see parents using. There are biological and genetic factors, including evidence that youth may be sensitive to nicotine and therefore become more dependent more quickly than adults would to these e-cigarettes and the nicotine in them. And then, let's see, what else? Mental health related. There was a strong relationship between youth using tobacco products and anxiety, depression, and stress. And then some other factors that can kind of go along with that are lower income, education, and socioeconomic status. Those all increase the risk factor for youth using these e-cigarettes. Lack of parental involvement, poor self-image, and self-esteem all kind of contribute to the use of e-cigarettes. And then finally, the accessibility, availability, and price of tobacco and e-cigarettes all kind of contribute to increasing that risk factor for youth.
Okay, so one of the things that we talked about for decreasing this as an overall public health issue is raising the age of being able to purchase them to age 21, because since it's definitely a popular youth problem, and there's many youth that are 18 in high school, it's easy for them to get access because it's actually legal. So they can buy it, share it with their friends. And we know there's all sorts of ways that they can get it that are illegal anyway. But by raising that age limit, I think would have an impact on their, at least accessibility.
Right.
We've already seen locally in gas stations and other places that sell e-cigarettes, they've started to put labels out as basically a big public health campaign or a requirement that they're required to now put those out there, that the risks of them and that they're unsafe. So we discussed in our previous group meeting about different ways that we can reach youth. And one of the programs that reaches the most amount of children in our country is Red Ribbon Week. And according to their website, it's the largest and oldest primary prevention campaign in our nation, and it reaches about 80 million people each year. And so in going through their campaign and their website and everything, it teaches you how to engage kids, teach them, educate them, even test their knowledge, and have them pledge to remain drug-free. One of their strongest arguments is that children of parents who talk to their teens regularly about drugs are 42% less likely to use drugs than those who don't. Yet we only have a quarter of teens reporting having these conversations. So it's not only an outreach to schools, but we need to reach out to parents as well. And there are definitely ads out there that are geared towards parents talking to their youth about alcohol and drugs and those types of things. So one thing that we need to incorporate is the use of these e-cigarettes, especially because it's definitely become one of the most serious problems facing our youth right now. With that being said, going through the curriculum, there's curriculum on this Red Ribbon Week based on age group from elementary age, middle school, and high school ages, with different activities and things for each of them to do. So there are different drug awareness activities, facts, and I did finally find some information about e-cigarettes themselves, but it took several steps and looking for that specific topic before I got that. It's nowhere in the material that it's in the forefront. And currently, their for younger ages, for 8th grade and below, their Heads Up Real News About Drugs guide that talks about different drugs that are being used is very outdated information. It talks about nicotine use, and the information says that the percentage of teens who use nicotine at 8th grade, 10th grade, and 12th grade, and it's in a graph, it shows only from 1997 to 2002, which we know is before e-cigarettes started to be marketable. So at the time, the use of nicotine or tobacco-related products was at an all-time low, and it shows over that course of time that all the trends going down. But as we know with the statistics that have come out, that e-cigarettes have basically taken over. So at an all-time low of tobacco use and nicotine use, now we're seeing this surgence of e-cigarettes. So the information that's being taught is very limited as far as e-cigarettes. The section for teachers to be able to teach about it talks about how e-cigarettes are enticing to youth. So it talks about cool images, fun images, flavorings, patterns, and all sorts of things that are designed for youth. And then even from that point, you have to click on an additional link to actually get the proper information that you would need to teach someone about e-cigarettes themselves. And like anything else, the current information goes over how an e-cigarette works and how it heats it and creates those chemicals into vapor, and how that's then used. So it does give a lot of information that can be used to teach and educate children. It talks about the risks for teens, and that 9 out of 10 adult smokers started smoking tobacco cigarettes before age 18. And that's because, and the reason that they're targeted is because people who start smoking in their teens, when their brains are still developing, are especially susceptible to the addictive effects of nicotine. So what I was seeing is that there's whole units and sections and videos and art contests and ways to incorporate it with drama for many of these other drugs that are used by kids. And so that seems like that's a stressed campaign, especially in the opioid and narcotics area, at which prior to this recent focus was, I think, probably one of the bigger areas that teens struggled with. So what we would like to do is bring this e-cigarettes information to the forefront, and especially in campaigns that are already reaching 80 million people. We feel like it should have dedicated information, the risks that we've talked about, the reasons why it seems so appealing, and be able to utilize that in more things than just one outdated graph and some quiz information. So even though it could, we feel that it could benefit from having its own focus, since there's already a campaign out there that reaches so many people, we feel like it would be beneficial to have that incorporated into this program. We feel like where it lists the criteria and the resources in every age group, this could be something that is a focus. So along with raising the age group and incorporating it into Red Ribbon Week, some of those other things that we need to do is have anti-e-cigarette ads and similar commercials and things that appeal to parents, so that they can talk to their kids about them. Because a lot of the information that I found, and being a mother of teenagers in high school, is that my children's friends are able to conceal it because it doesn't have the smoke and smell and other signals that parents would recognize right away. And they're able to hide the cartridges in concealable ways, like necklaces, keychains, and other things that make parents unaware. So it's important to get this information out to parents as well as kids, so that they can have a conversation and just be educated. We don't feel like this is going to stop tobacco use. I don't feel like a ban on e-cigarettes would be beneficial. I mean, there's lots of, historically, bans don't work. Banning alcohol doesn't work because people find a way to make it. Banning guns would not work because people are going to find ways to get them, and the people who would be responsible with any of these products aren't the ones that are going to be finding them. So I think we're going in the right direction as far as the government limiting the forms that are geared towards kids, like the flavors, and the other things that are basically marketed for children's use. If it was like we talked about, if it was used as a smoking cessation product, just like the gum or anything like that, then that'd be different. But the fact that it's marketed to children and that they don't understand the repercussions, that we're all starting to just now find out, because research does take a long time, and we still don't have all the facts, and we don't know the long-term consequences of what will happen with this. So it's very hard to educate on things that you're still learning about yourself. But if we don't educate these kids who think that it's just a safe form of smoking, then like we've stated in our statistics, then more and more youth are going to die from these lung and heart diseases or anything related to the effects of this e-cigarettes. What do you guys think?
Yeah, I think that's perfectly well said. I mean, I think education is the best way to go about it. And just in summary, like you said, we're still learning, we're still trying to get all the information, but as we try to educate and as we see updates, I think that's the best thing, because these kids, they see it as appeal, it doesn't smell, it's not making their teeth yellow, they can conceal it and stuff, but hopefully through education and things, we can get it out there, maybe start getting it more at the forefront of their minds that it is harmful, and as we learn more, all of this education will help us get it out there and hopefully eliminate some of these deaths and respiratory illnesses.